Ben Anderson, Vanguard Chiropractic. I wanted to talk to you about lumbar discs, herniated lumbar discs, because this is such a common problem and such a painful problem. The anatomy of the problem is we have discs in between all of our vertebrae, and they allow for motion. They're cartilage plates, and they're made of rings. They look like rings of a tree trunk. If you were to cut a tree and look at the rings, that's what it looks like, except inside there's a jelly called the nucleus pulposus. And that acts as a ball bearing, because one of the physical properties of a fluid is you can't compress it. So you can press down with thousands of pounds of pressure, and this is stable. A disc is stable. It won't herniate. When they herniate is when they're vectored. They're turned like this, like you're bent forward, maybe picking something up, which loads the joint. It's very common. And then what happens? You get radiating pain down the leg. You get terrible back pain and burning pain that moves down. And why this happens is the jelly has pushed the cartilage out to where it's touching nerve as it goes down your leg. So there's nothing wrong in the leg. It's touching nerve as it goes down into the leg. And what we can do is work backwards off of that. So that will go down, that nerve will go down, and it will go into muscles. And those muscles will dysfunction. Like drop foot is a very common thing to happen with people that have a herniation of their L4 discs, which hurts their L5 nerve root, which innervates their tibialis anterior, which pulls their foot back. And so it won't do it, and the foot goes down. And they'll trip, and they notice that they have drop foot. What we can do, like what I did last Friday, I saw a guy with drop foot last Friday, had it for years, on and off, not all the time, but had it for weeks when he came in. And what we did was we put him on the table and we angled his back at different angles. And he actually worked. The tibialis anterior functioned when he was at different angles. Characteristic, he was an 80%er. Most people, there are characteristic ways that it happens. And through proper treatment of loosening up muscles and adjusting and tractioning the spine with vectored force, meaning I'm on his back as it's being tractioned in the appropriate way. It's all very specific and tailor-made. He didn't have drop foot when he walked out. He came back on Monday. He was in much better shape. So what we like to do is a functional exam and figure out specifically for each person how that nerve root is being trapped and address it specifically. After unimpinging the nerve root, we can do a treatment to level out the pelvis with blocking the pelvis and doing treatments to make it the most biomechanically advantageous for the patient. And then with strength and stabilization, the work lasts. So if this sounds like something that applies to you, if you think that maybe this is something that you haven't heard before and would like to give us a try, I'd love to extend you a discount to come in and spend an hour with me and do a physical exam. See what we can do. So call the office at 512-328-4041. Check us out at vanguardchiropractic.com. And I hope to see you soon. Thank you for your time.